Hello, my name is Dr. Jeremy James. I'm an orthopedic spine surgeon at Disc of Louisiana, and today we're going to be talking about neck pain. You can break it down into several different categories. Probably the most common is a neck sprain, which is ultimately an injury to a muscle or abnormal stretch from a muscle. And this is the most common type of neck pain that almost everybody at some point is going to experience in their life. It can be from trauma, it can be from sleeping wrong in a bed, but ultimately it can cause sudden neck pain. Sometimes very trivial things can cause it, and ultimately at some point everybody's going to have this type of neck pain. When we start talking about disc injuries, this is the front view of the neck as we're looking straight on. You can see bone, disc, bone, disc, bone, disc, and ultimately these discs are, for all intents and purposes, shock absorbers both in our neck and our back. And inside these discs is filled with water. And this water is a good shock absorber. As we age, we start losing some of that water and we start having degeneration, but ultimately you can have an acute disc injury. An acute disc injury would be a trauma to the disc. When the disc is traumatized, it can start losing its water content and then starts to collapse, kind of like, if you think about like a flat tire. The material is still in there, but it has to collapse, so it collapses down, bulges out. And ultimately what that does is if you look at the back of the spine model, at each level we have two facet joints, and they're kind of like shingles. I'll kind of try to open them up some. And so as we lose the disc height in the front from the disc, these shingles also lose height and start grinding more and can cause neck pain. If you have an acute disc injury along with a disc herniation implies that ultimately material has come out of the disc space and sitting next to the spinal cord and or the nerve roots. When that happens, that usually causes pretty significant neck, but also adds the arm pain. Most people can tolerate some of the neck pain, but arm pain is usually very intolerable for people. So a disc injury can be from something very trivial, a cough, a sneeze. It can be from a whiplash, a fall. It doesn't necessarily have to be something that you remember. It can be something very trivial. So the key for all of these types of injuries, especially the pure neck pain, is motion, motion, motion. Stiffness equals pain. And so when we injure our neck, we typically stop turning it because we're programmed to protect ourselves. So ultimately, if it hurts to turn to the right, well, we can get through our daily lives and we won't turn our neck to the right. We'll start looking to the right, we'll turn our shoulders instead of our neck. The problem is our muscles do not like surprises, and so if you're not showing them emotion all the time and you're protecting them from that motion, ultimately that's going to cause stiffness and cause more pain when you do that motion. If you feel like you have any of these symptoms or any questions, concerns, we'd be more than happy to see you at Disc Louisiana to discuss anything you would like.